she had 2 puppies earlier, and they both died. And we don't know if she has any more inside. I really need to see if the puppies are there and if they're alive or not. Should we see if you got more babies in there? Should we check you out? Let's check you out. Sometimes we have dogs that just stop their labor. That's not a normal thing to happen. There's usually something bad going on. It may just be that the uterus itself is exhausted. So, looking to see, there's at least 1 skeleton inside. Important question is there a little heart beating in there? I'm just trying to get to her chest, see if I can see a heart beating or not. And you are a little anxious, lovin'. I don't think I'm seeing a beating heart. All right. Oh, you're a good girl. Good girl. I just need to see if your baby's okay.
The Cocker Spaniel was rushed to emergency after she delivered 2 deceased puppies at home.
Ah, beating heart! Heck yeah!
Yay!
1 baby's alive. Okay, let's see if we got more babies. It can be hard to know how many puppies are there based on ultrasound, but one thing that ultrasound is really good at is it can help us see if the heart is beating and if the heart is beating fast enough or too slow, which can let us know, is it appropriate to do medical treatment. You see that flickering in there just to the left of the screen? You've got a live baby and that heart rate is a good heart rate, so that is good. Good job though, Mama. Yeah, you were very brave. Can I look at the rest of you then?
With the 3rd puppy potentially in danger, Mara urgently needs to find out why Pippa's labor isn't progressing.
All right. So we've got at least 1 baby who's healthy, as far as I can tell, which is good. We will just have to see
That's good news.
why she has stopped passing her puppies out. Look at how big your paws are. They're gorgeous. You know that? All right, sweetheart. You need your hind end. Perfect, thank you. Okay. Oh, we are doing a vaginal exam so that I can see if her cervix is still open. It is. And she's not doing any muscle movements in response to this, and if she was in active labor, I would expect. But I can feel something. Are you thinking of trying to get a puppy out? Sometimes we can have other things that can affect the uterus's ability to be able to contract and basically push the puppy out. So sometimes our patients have a low blood sugar level because they're just exhausted and don't have any more energy. Sometimes their calcium level is low, and calcium is actually an electrolyte that's really, really important to help muscles contract anywhere in the body. Mamacita, your calcium's a little low. But we can fix that. We can fix that. Yes, we can. And then we give oxytocin, which is a hormone that is used in women when they are induced for labor, and we use it with dogs. Basically what that does is that triggers the uterine muscle to start contracting. Oxy in, calcium in, all good? Yay! Mama, should we get you settled somewhere nice and cozy? Okay, you go to bed.
If the oxytocin doesn't work, Mara's concerned that Pippa may need emergency surgery to get her puppy out safely.
So it's a lot more invasive doing the surgical approach, but sometimes that's what you need to do to try and get live puppies out. Yes, I know, Mama. And get a little live puppy out sooner rather than later.
Pregnant Pippa has suddenly started showing signs of labor.
Gloves.
And Mara quickly swings into action.
Hi. Okay. Looking in, I see there's this puppy completely enclosed in the sack with everything still attached, not moving, looking like it's dead. Okay. Yes, scream at me. Scream at me. Get mad. I know that I've got to try and do anything I can to see if I can save this puppy. Guys, I need oxygen. Trying to get its airways clear of fluids. My goals are the same for any patient that comes in unresponsive. I'm looking at the ABCs. So do they have an open airway? Are they breathing on their own? And is there evidence that their heart is beating? Can someone get me a new towel, please? I'm trying to get oxygen into the puppy either through the oxygen mask or even doing a little bit of blowing directly into its nose with my mouth. All right, if you could go into the crash cart, please, and open up a vial of adrenaline and just get me a little bit in a syringe because I'm going to give our friends a little drop of adrenaline. And I'm vigorously rubbing the puppy because that's the best way to get stimulation both to the lung and to the heart to see if we can't get anything to start to move in the right direction. We are not breathing, but with puppies you don't give up until you've been going for quite a while. Unfortunately, I have no idea if we'll get this puppy back. Are you comfortable rubbing our friend like hell? Yeah. Great. Because I'm going to give our friends a little drop of adrenaline. Keep rubbing your stuff. Nope, keep rubbing. Okay. I'm going to borrow your stethoscope while you're taking that. Stop for 1 second. Keep going. Really, with these ones, if after 30 minutes of very vigorous rubbing, oxygen, a little bit of adrenaline and atropine, you get nothing, only then do you finally give up. But you just keep going and going and going because it takes them a while to realize that they should be alive. Well, it's hard. I know that this was not a planned pregnancy, but I know that Pippa is definitely a very beloved member of the family. And while there's always good and interesting things with emergency medicines, I don't have a great feeling about this. Yeah. Sometimes we don't win.
Yes, I couldn't hear one.
Yeah, no. I think we're done. Thank you, but we're done. And while it's sad, I can't sit and dwell on it for too long because there tends to be 3 or 4 other patients needing me to help them. Hi, baby. I'm sorry. I think you just took too long. Okay. You give them a couple of minutes of thought. Might think about it some more on my drive home later on, but I oftentimes have to basically switch that concern off and move on to the next. Hello. We're gonna poke you, little oven. All right.
Now Mara is turning her attention back to Pippa, increasingly concerned she might still be carrying more puppies.
I'm just checking right now with ultrasound to see if there's any other babies that I can find. There is one, at least one more in there. I'm just trying to see if there is a heartbeat. Yes, there is a heartbeat. There is at least one more puppy in here with a heartbeat. Oh, beautiful. Right.
Mara and her emergency team are still flat out.
You just had a baby.
When suddenly, pregnant Pippa delivers her 4th pup.
Good girl. Good girl. Literally 2 minutes after the last check, she's just had a puppy. And so by the time we got there, she'd already licked the puppy clean. We missed the entire thing, but she did a good job on her own for that puppy. Here's a little girl. You got a little girl. Oh, good mama. It's always great to get to see a live puppy come out, especially when we know that there's been dead ones that have come before. It just really gives us something positive to focus on when we've been dealing with sometimes some sad emergencies. It's a nice little gift. Yes, we want baby screaming. What do you think? Are you gonna clean her up? Are you good mama? Yes, you are. She can hide under your ears. You know that? She could hide under your ears. So Pippa's gonna go home and she's probably gonna be a really good mom for her baby because how she's acted here in hospital so far, she's very, very involved. So I expect she's gonna spend the next couple of weeks at home mothering that little baby, probably being really happy to no longer be pregnant. You're a very good girl. Yes, you are. Oh my God. Oh, you're too cute for words.